A word that we brought up frequently this hour that is associated with pelvic organ prolapse is incontinence. What is it exactly? Can you explain that to us, Dr. Sirven, because I know we have viewers at home who are tuning in right now.
Well, when we talk about incontinence, let's talk about urinary incontinence per se. Urinary incontinence is pretty much the emptying of the bladder coming out through the to the urethra, and it's the involuntary losing of urine through your bladder. The involuntary losing of urine through your bladder is associated with three major types of incontinence. Stress incontinence, caused by incontinence of pressure somehow, increased abdominal pressure causes you to lose urine, for instance, when you cough, when you sneeze, when you exercise. There is urge incontinence, in which you have incontinence that is associated with the involuntary contractions of your bladder, that somehow you're getting to the bathroom, and before you get to the bathroom, they open a faucet or something, and somehow you lose urine. There is a combination of both, and there is overflow incontinence. We tend to see this a lot in patients who have pelvic organ prolapse because they have had increase of the bladder area with the weakenings and change in the angle of the bladder neck. And now when they empty their bladder, they don't completely empty their bladder. And they still have a large amount of urine in their bladder, and then tend to have leakage and overflow type. We could also have this type of incontinence in patients who suffer some type of neurological condition, trauma, or something in which the innervation of the bladder is affected somehow, and they will have also overflow incontinence.